Welcome to Thrive Physical Therapy and Sports Medicine of St. Louis, where you arrive to thrive. Thank you for joining us for the launch of our new company website. We would like to start this tutorial with an introduction to our company mission and vision. Our mission at Thrive Physical Therapy and Sports Medicine of St. Louis is that it is a single-standing, privately owned sports medicine physical therapy clinic located in West County of St. Louis, Missouri. Thrive PT specializes in the evaluation and treatment of athletes of all ages. Our mission is to help individuals to achieve goals related to their specific athletic abilities and talents, utilizing the most advanced evidence-based treatments. Our vision is that this facility will focus on a plan to learn and develop a sport-specific treatment to enhance the efficiency and safety of athletes of all ages. Looking to the future, we are hoping that by 2022, sport-specific training will be delivered to all age groups by direct access from board-certified doctors of physical therapy. Clients will have access to innovative and individualized programs that will enhance their athletic ability and safety. Physical therapists may be assisted by physical therapist assistants who meet all state and federal qualifications.
Thrive Physical Therapy and Sports Medicine is an equal partnership owned and operated by two doctors of physical therapy who share an equal profit and liabilities. Now to our team, which consists of 2 full-time physical therapists and 1 full-time physical therapy assistants, as well as 2 office managers and secretaries. The first physical therapist is Robert Johnson. He has his doctorate. He graduated in 2011 and has been practicing in orthopedic medicine for 6 years. John Jacobson is the second physical therapist who has his doctorate of physical therapy, as well as his sports clinical specialist, and has been practicing in sports medicine for 9 years. Katie Smith is a physical therapy assistant and has her associates and has been practicing in sports medicine for 4 years. And Megan Martin and Shelby Gino are the office managers. And physical therapists are individuals who have obtained a professional physical therapy degree and who are licensed by the Federation of State Boards of Physical Therapy. Physical therapists provide services related to orthopedic, neuromuscular, and cardiovascular systems, as well as sports medicine diagnosis. Physical therapists evaluate, examine, develop, and carry out plans of care and discharge patients to assist them in returning to or improving athletic performance. Interventions may include manual therapy, strength training, proprioceptive re-education, neuromuscular re-education, flexibility, endurance, as well as much more. Education requirements. Physical therapists must hold either a bachelor's, master's, or doctorate in physical therapy. They must have at least 5 years of experience in sports medicine or orthopedics, and additional credentials are welcome but not required. Their starting salary is $78,000 per year, and benefits include health insurance, paid vacation and holidays, and have starting paid time off of 2 weeks. Physical therapy assistants must obtain a 2-year physical therapy assistant degree and be licensed by the Federation of State Boards of Physical Therapy. Physical therapy assistants work under the supervision and direction of a licensed physical therapist. They assist in facilitating an established plan of care provided by the physical therapist. They provide services related to musculoskeletal, cardiovascular, and neuromuscular systems, as well as sports medicine. Interventions provided by the physical therapy assistants include physical agents, therapeutic exercise, therapeutic activity, gait training, sports-specific training, and much more. The education requirements, they must hold an associate's degree in physical therapy assistance. They must have at least 2 years' experience in orthopedics or sports medicine, and additional requirements are welcome, but again, not required. Their starting salary is $43,000 per year, and their benefits include health insurance, paid vacation and holidays, and starting paid time off includes 2 weeks. The secretary and office managers are responsible for all office-related duties, including, but not limited to, scheduling appointments, communication with insurance, answering phone calls, communicating with patients and therapists, filing, and faxing necessary documents. These personnel are also responsible for the general cleanliness and organization of the clinic and any corresponding duties. The education requirements is that they must hold a high school diploma. No previous experience is required. Potential employees should be proficient in Microsoft Office, including Word and Excel.
We will now click on the Services Offered tab. This tab will help us to learn more about what can be expected if you choose our clinic. Here at Thrive, we are excited to offer a vast selection of services, including manual therapy, physical agents, therapeutic exercise, therapeutic and functional activity, gait training, neuromuscular re-education, sports-specific training, athletic and kinesiotaping, and gait analysis. These services are offered to athletes of all ages in our community. We commonly see athletes such as basketball players, soccer players, runners, hockey players, and many more.
Next, we will look at our documentation and communication. Documentation will be done on tablets and desktops owned by Thrive PT. WebPT will be used for scheduling, documentation, and billing purposes. All computers will be password protected. WebPT also requires a login for each employee in order to access his or her patient load at any time. Communication. Being a good communicator is key for employment status at Thrive PT. Employees will be expected to be effective communicators with coworkers, patients and their involved party, insurance companies, case managers, and people in the community. Employees will express their communication skills through proper documentation, everyday interactions with coworkers and patients, phone conversations, faxes, business meetings, and emails. Employees will also be expected to show appropriate nonverbal communication skills during interactions. Positive and appropriate body language, such as posture and facial expressions, are expected and should be applied on a case-by-case basis. Employees are expected to be culturally competent in order to be effective communicators. Risk management. The risks involved at Thrive PT will be addressed in different ways. Thrive PT will have general liability coverage, malpractice insurance, and employee benefits to keep patients and employees as safe as possible. Patients' privacy and health records will be stored in a locked file cabinet and destroyed 5 years following discharge. As for any current documentation on patients, computers will be password protected with changing passwords every month to ensure optimal privacy. Thrive PT will adhere to CDC's guidelines and policies for infection control with proper cleaning of the facility and its equipment.
Next, we're going to look at the Policies and Procedures tab. Here we have listed all of the policies and procedures that are included in our business plan. For this first policy and procedure, that includes employee orientation. Employees will be oriented on a one-on-one basis with an employee of the company for over a year. A period of 1 month will be allowed to complete the orientation process. The second policy and procedure is performance appraisals and peer review process. Performance evaluations will be conducted at the end of each employee's initial period and then once a year or more frequently if needed. Employees will be asked to complete peer evaluations of each of their coworkers at the beginning of the year. The evaluations will be anonymous because the employees will complete them online and submit them to the partners for them to review and distribute to each employee. The third, hours of operation. The clinic will be open Monday through Friday from 6:30 a.m. to 6:30 p.m. The clinic will be closed on the following holidays: New Year's Day, Memorial Day, Independence Day, Labor Day, Thanksgiving, and Christmas Day. The fourth, standards of conduct. Employees will comply with all applicable laws and regulations. It is expected all employees conduct business in accordance with the spirit and intent of all relevant laws and to refrain from any illegal, dishonest, or unethical conduct. Number 5, anti-harassment and discrimination. This facility complies with all ADA accommodations, ensuring equal opportunity and employment for qualified persons with disabilities. Number 6, employee dress code. Employees are expected to dress professionally every day. Cotton/khaki pants and dress pants are acceptable. Polo shirts and dress shirts are allowed. Sleeveless, low-cut, or midriff shirts are prohibited. Tennis shoes or closed-toe shoes are required. Number 7, CPR and AED. All employees are required to be CPR, AED, and first aid trained and certified. Failing to become certified could result in a termination of pay until certification is obtained. Number 8, patient privacy/Bill of Rights. All HIPAA policies are to be followed to maintain patient privacy. Patients have the right to their health record and to privacy of their health care. Tablets used by the therapists are owned by Thrive Physical Therapy. Therapists are to not take the laptops home, and all documentation is to be password protected for patient privacy. Any violation of this policy will result in immediate termination of employment. All other policies and procedures can be expanded upon if you call Thrive Physical Therapy and Sports Medicine and talk to one of their employees.
Lastly, we will go over our utilization reviews and outcome measures. Utilization reviews. Therapists at Thrive Physical Therapy will be responsible for proper analysis of their patients on a case-by-case basis. Ways utilization will be analyzed include reviewing past cases and making sure the appropriate care was provided, appropriate case management and discharge planning, yearly anonymous peer reviews of clinicians, 4 continuing education courses completed in a calendar year. Completion of course will require a clinical review of the course to ensure the therapists receive valid information. Following a CEU, clinicians will be responsible for presenting 1 yearly in-service on the knowledge they gained. And lastly, comparison of medical files with different treatment guidelines to ensure the best treatment for patients. Outcome measures. Thrive Physical Therapy prides itself on using the most appropriate and reliable outcome measures to ensure patients are getting the best treatment possible. The American Physical Therapy Association keeps an updated list of appropriate outcome measures to use in the clinic. Therapists will be expected to maintain their APTA membership and access the APTA website for appropriate outcome measures based on their patients' needs. Sample outcome measures that will be utilized include the Lower Extremity Function Scale, the Oswestry, disabilities of the arm, shoulder, and hand, the Lysholm Knee Scoring Scale, the Neck Disability Index, the Dynamic Gait Index, and the Sports Ankle Rating System. Patients will also be given a quality of care questionnaire 2 weeks after beginning treatment at Thrive PT and again at discharge. The questionnaire will address the following areas on a scale of 0 to 10, with 0 being poor and 10 being excellent. These areas include the environment, including the cleanliness, layout, lighting, and temperature, the therapist, their professionalism, efficacy, and communication skills, the office, including scheduling, billing, and organization, and lastly, the treatment. Productivity of each clinician will be assessed every week by the clinic manager. Each therapist is required to maintain an average productivity greater than 90%. Thank you for visiting the Thrive Physical Therapy website. We hope you enjoyed your virtual tour.